Whether you are the medical student, paramedic staff, this is the video you should not skip it and watch till the end. So hi friends, Pharma-SS is here, and here in this video we would discuss the essential emergency medicines one should know. So we learn what are the emergency medicines called, what they included, their route of administration, mechanism, uses, doses and adverse effects. So let's start. Emergency medicines are medications that used to treat patients in urgent or life-threatening situations where delays in the treatment could cause harm. Is a medical specialty that focused on the immediate evaluation, diagnosis, treatment, and management of patients in conditions that require rapid intervention such as opioid overdoses, severe allergic reactions, or cardiac arrest. Here is the mostly prescribed emergency medicines, and in this video we would learn the first medicine, that is the epinephrine. Epinephrine, also known as adrenaline, is often called the body's fight or flight hormone. This powerful drug is a lifesaver in emergency situations. It belongs to the alpha-beta adrenergic agonist class, meaning it stimulates both alpha and beta receptors of the body. Through its alpha effects, epinephrine boosts heart rate and cardiac output, while its beta-1 and beta-2 actions help relax smooth muscles, open airways. Adrenaline is a first-line treatment in critical scenarios like allergic reactions, type 1, including anaphylactic shock, where it acts fast to raise blood pressure through alpha-1-mediated vasoconstriction and restore breathing via beta-2-induced bronchodilation. It also plays a similar role in severe asthma attacks, causes the vasoconstriction, increase the pressure and reduces the mucosal edema. Cardiac arrest, like previously discussed, it is the alpha agonist, and due to this it will cause vasoconstriction. It's also used in cases of hypotension due to septic shock, and even to dilate pupils during ocular surgery. It can be delivered via IV, IM, SC, or IO routes, but avoid injecting it into the buttocks, hands, or feet due to poor absorption. It comes in concentrations of 0.1 mg per milliliter and 1 mg per milliliter, and in the ratios 1 to 10,000 and 1 to 1,000 that are no longer recommended on labels. In cardiac arrest, a typical dose is 0.5 to 1 mg IV, diluted in 5 to 10 milliliters. For anaphylaxis, 0.3 to 0.5 mg is given IM or SC. For continuous treatment of hypotension, an IV infusion of 0.05 to 2 mcg per kilogram per minute is used. While adrenaline can be life-saving, it's not without side effects. Common ones include dizziness, dyspnea, headache, anxiety, palpitations, while the more serious include tachycardia, angina, hypertension and respiratory problems. If you find this helpful, don't forget to like, share, subscribe Pharma-SS and hit the notification bell so you never miss an update.